My name is E. Rice Williams Jr. I'm the president and co-founder of Williams and Associates, and we're a community-based public health agency addressing minority health disparities. We try to address minority health disparities and health equity through partnering with agencies like Prevent+Ed and other agencies in terms of looking at health ailments that disproportionately impact minority populations. Things like substance use, mental health, HIV and STDs, cardiovascular disease, all of those ailments, that the Department of Health and Human Services has deemed as ailments that people are disproportionately impacted by. I think some of the variables in terms of why there are certain portions of our populations that are disproportionately impacted by substance use and other health ailments have to do with some of the social issues that impact those those populations in terms of number one being economics, employment, education, those social determinants of health, and also looking at other variables like mental health, trying to self-medicate, in terms of dealing with mental health issues, and in the case of opioid use, dealing with chronic pain and finding themselves, addicted to the medication as well, and just really trying to find a quick fix, I think, in terms of not only mental health issues, but other physical issues too as well. It's something that's affordable, because access to good health care is a challenge for some in our populations. And so sometimes street substances, like fentanyl, opioids, or crack, or alcohol, or marijuana, those are kind of quick fixes, in terms of trying to deal with certain things. Some time ago, I've looked at it as a mission, and I think that's the difference between a job and a mission. When you are committed and you have some passion for something, you just find yourself doing it, and it doesn't seem like work. Does it get frustrating? Yes, it does. Does it have its challenges? Yes, it does. Financial challenges, community support challenges, staff challenges, but it's the passion for the work that keeps me going. And the need that I've had for quite a while, and my mother reminded me of this a few weeks ago, that I've always wanted to help people, and I think back on it, I did, even in middle school, I was helping folks, and so I think it's the helper in me that keeps the ball rolling. As we all know, we're in the midst of a pandemic, and I think one of the things that I've learned since for the past year in dealing with this pandemic is that, and I know it's like a corny line, but it really is true. We really can achieve a lot when we work together, and we can get through a lot when we work together. And so, just like we're struggling our way and finally seeing the light in the tunnel, we're still in the tunnel, but we see the light. We're going to see the same thing with the opioid epidemic as well. We will start to see the light, and we'll start to see some improvement, but that can only happen when we work together. Well, first I want to thank Prevent+Ed for recognizing the work that we do. It's not always that you get, because I've gotten recognition before from people out of state, or but it always feels good when people from where you're from say you're doing a good job. So I really appreciate that, and I think, of course, we can't do what we do alone. So I think partnerships and willingness to communicate even and work together, with several agencies, in the city, so I thank for their willingness to want to work with us, because it is definitely a pleasure.